episode of the Pediatric Breathing Project. I am your host, Dr. Piya Gandhi, and I am very excited to have our first guest on the podcast, my very good friend and colleague, Catherine Kangas. She is the owner of Integrative Myofunctional therapy practice. She is also the author of Your Tongue Has a Home, which we're going to talk about a little bit later. And she just created an oral recovery kit as well. So thank you so much for being here and spending your morning with us.
Thank you for having me. I'm excited.
So I'd love to start by just hearing a little bit about your journey. I know we connect on a lot of this as mothers and what brought us into the airway tongue tie field. So I'd love for you to share some of that with us.
Yeah. So I was the mom that we see so often, where you have your first child and you envision, this beautiful breastfeeding relationship, and you're so excited, and then and it didn't go that way, right? We struggled from the start, and you name it, the colic-like symptoms, torticollis, all the things, and it was so hard. It was a journey, and not, I was trying so hard to find help, and there, even, going to the pediatrician, going everywhere, lactation, and that's really where it began. And, as a parent, as a mom, you just keep searching for answers. You don't take, well, they'll grow out of it by 6 months. You keep looking and keep digging. And anyway, through CE, discovered myofunctional therapy and airway and tongue ties, and light bulbs started to go off, and you know how that goes. It just, you keep digging and digging. And then I had my second son and more things started to come together. So, along the way, we were able to kind of put some of those puzzle pieces together.
Sure.
But it took time, and it took a lot of trial and error and trying to find the right providers. And eventually told my husband, I want to do this. Yeah. I'm not doing the right thing. Like I need to be on the professional side of things. And so that's how I really got here, was through my own personal journey.
And how did your husband respond to that?
Oh gosh. Well, hindsight, it was 2020.
Yeah.
So and I wanted to do a career change. So I was staying up really late at night and taking a lot of online courses, and then he's honestly very supportive, and he was like, okay. Yeah. And so I quit my full-time job, and I was doing hygiene part-time, and then just starting to, you were one of the first people I reached out to. Yeah. And I really just tried to go after it, because it was it was such a passion of mine. Right. Like, we need more providers. Parents need help.
Yeah, so, I do think it's interesting when your husband's not in the dental or healthcare field, right? Yeah. When you try to explain that you're going to make a whole career out of this, and the response that you kind of get is just like, is this really, like, this is really possible? But to your point, I think when you've lived it as a parent and you're so passionate about it, and not only that, you continue to take a deeper and deeper dive, you can, this is really an entire practice within itself. And so it is almost never ending, the extent that we can go.
It's incredible. And just how much you start to peel back the layers, and truly, looking at it started to make a lot of sense for myself. Yeah. I got into this for my kids, and then I started realizing, because I've had multiple neck surgeries, I've been dealing with chronic pain, sleep issues that I didn't really even knew existed until I started understanding more. I'm like, this is why I don't feel great. Yes. And so, it's a rabbit hole for sure. Sometimes it's like, maybe I don't want to know.
Well, and I think it's interesting because coming from the dental field, we think, we're just going to be working like right here, right? This is our wheelhouse. But the more we learn about this, the more we understand that it's really like full body connection. Oh. And then the rabbit hole really never ends. So with that said, like in your practice, what age ranges do you treat? Like, what are you focusing on? I know you've also taken some training in like Buteyko breathing. Yeah. So talk to us a little bit about your practice and kind of what you're addressing through myofunctional therapy.
Yeah. When I first got into it, I was kind of trying to figure out my footing of where because I feel like we all have our strengths and who we can really help. So now I really focus on ages 5 and up.
Okay.
The littles under 5, I think, are really well served by our speech language pathology friends that really understand this world. And I see a lot of kids that have tongue ties, orthodontic expansion needs, sleep disorders. Maybe they've been in speech therapy for 7 years and they've just hit a plateau. Like those types of kids do come to me. And I love working with them because the parents are really trying to help their child. And then I see a lot of adults. I think people are really surprised that myofunctional therapy is not just for adults. These airway treatments that we do, tongue ties, expansions, not just for kids. Did I say that?
That's like you said, adults.
Not just for kids.
Yeah.
It is for adults too. There's really not an age limit.
One thing I would like to ask you about, because I get this question, and maybe you can explain a little bit, is I get adults and some kids that, yes, they have a tongue tie and parents or the patient just want to treat the tongue tie, and explaining to them the oral structure and how myofunctional therapy can be much more difficult to achieve if you don't have the right structure. So from your standpoint, if you do see a person with a tongue tie but doesn't have needs expansion or needs, more structural changes, how does that impact your ability to succeed in the myofunctional therapy?
I think it's hard. We're asking them to teach their tongue to live in the roof of their mouth. Try to explain to people, it's like trying to park a Suburban in a garage that was made for a motorcycle. It doesn't fit, right? And you're gonna struggle. And so, especially for kids, we don't want them to burn out. Mm-hmm. We want the therapy to be successful, and we find success by making strides through therapy. It's not just you don't realize it until all the way at the end, right? And so if they're struggling early on and it's frustrating, it's going to become frustrating for the parents because they're trying to force them to do these exercises. So I find that really compliance and just feeling successful through the program is greater when we have the space to work with.
Yeah. And so, if you could just touch on what are the primary goals of myofunctional therapy?
Yeah, at a really high level, oral rest posture, proper oral rest posture is our goal. So tongue up, should be resting in the palate without strain. Our lips are together all day, all night. And that is, when we're not talking, eating, drinking, and exercise is a little different, but tongue up, lips together, and you're breathing through your nose. It sounds really simple,
but it's not.
But it can actually be extremely difficult for a lot of people. And a proper healthy swallow pattern is a part of those goals. Yeah.
And I know you and I know why nasal breathing is important, but maybe you could tell our audience why are those things important? Why do we need our tongue to be up? Why do we need to keep our lips closed?
Yeah. Breathing, airway is life, right? So if our tongue is down, we're going to automatically shift into more of an open mouth posture. We breathe more through our mouth, and then we have obstructions of our airway. Kiddos, it can change the development of their jaws. So we start to grow more narrow. It affects our posture. It can affect our nervous system. How we breathe greatly influences how we feel, anxious type feelings. Again, going back to this rabbit hole, you would not think, and people don't really think about it, but the way that we breathe can change the emotional and physical to a level that we I don't think, acknowledge enough in healthcare.
Agreed. And I'm sure everyone's experienced that when you start hyperventilating, it really just escalates this feeling of anxiety versus I know in my practice when a kid is, you can see they're getting more anxious. We take a break and we do some nasal breathing exercises, and that really instantly helps calm the nervous system. But it's surprising how many people cannot breathe through their nose. Yeah. So, I'm a true believer that I think everyone could use some myofunctional therapy to help just build awareness and retrain, because there has not been awareness about how we breathe for so long. And obviously you and I are in the practice of these types of myofunctional therapy and airway dentistry, but we do a lot of educating as well.
Yeah.
And I would love to talk about this book that you just published, another way of educating our families and our little friends. So tell us about this.
Yeah, it's exactly why I wrote it, was to teach parents, really, and children about healthy oral rest posture, what we were just talking about. This book is really just kind of a foundation of those concepts. Tongue up, lips together, breathing through our nose. And this was inspired by my kids.
Yeah, I was going to ask, how much of a role did they...
So this is my oldest, and then my youngest is on the back, so they loved being a part of it. I don't think they really understood, and it was really neat to actually show them a copy, like emotionally. It just like kind of hit me showing them a copy, because they saw me working with the illustrator and they didn't really understand like what that was going to be. And they're like, oh, it's actually like a book on a shelf. And I'm like, yeah.
So cool.
Yeah. But that's really what, not to sound corny or cheesy, but I really wanted to have just some sort of impact in this field, because I was that mom. I knew there was something that was not right, and you keep kind of getting brushed off, and you're like, wait a minute. So if there's anything, if this reaches a family to where they could connect some dots and start finding providers in their area, then then there's one person that we've helped.
Yes. Mm-hmm. And where can we find this?
Amazon.
Okay.
Mm-hmm.
Okay.
Amazon.
Awesome.
Yeah.
So everyone get their copy of Your Tongue Has a Home.
Yeah.
And then, Ben, who's your son, who started this whole journey, obviously you've been through the tongue tie stuff with him, but also some expansion work.
Yes.
So talk to me about your experience as a mom with your kiddo going through an expander and that whole process. I know that led you down another rabbit hole to help kids and any age kind of deal with these changes in their body. So how has that been for Ben?
I started seeing sleep disordered breathing patterns early. Mm-hmm. We never had an actual sleep study, but I didn't really need that. I knew he had sleep apnea. Yeah. He was stopping breathing at night. And we had all the things, you know this, like we had tonsil and adenoids removed because his tonsils were literally touching. But it wasn't enough. There was a reason his tonsils and adenoids were swollen. He wasn't breathing well. He wasn't breathing properly. He was underdeveloped, at a young age. He had a tongue tie. And so we've experimented. Like, I'm the mom that's kind of living through this. We tried a removable expander when he was 4. He did beautifully with it. He was like the most compliant little 4-year-old. We got a little bit, right? Yeah. And then, it's been a journey, and we just finished fixed expansion, upper and lower, with you. And he's been wearing his retainer and just doing so great. He did great. I mean, it's not no one's most favorite thing. Yeah. But, it's...
You make it work.
Yeah. And honestly, like, after the first week, it's just, I don't know, it's kind of just part of just
your body.
Yeah.
I mean, I think you just kind of touched on is the thing that we've realized from the parent side, because I've also been through this with my kids, is that it's a journey. You try... both of our children have lived through our education.
Yes.
And we have done things on them, and sometimes it works well and sometimes it doesn't. And, to the practitioners that are listening to this episode, just know that, it's a constant work in progress. Yeah. So if you're not doing any of this and you want to start, you got to start somewhere. Yeah. And you have to see how that works. And then if it's not working, pivot, and also we're working with the human body. So something may work great on one kid, but not the other. And, at the end of the day, I think everything that I've done on my children has helped some. Maybe that one thing didn't get us all the way to where we want to be, but everything is a small step in the right direction.
Yeah. And I think you make a great point, because, I really think the more I've been in this field, it's not a one size fits all. And that's something that I love that you do. You have multiple different tools in your kit, depending on the family, depending on the child, depending on the age, like all these different things. And I think it's so important because, we have kids that we see that have feeding challenges. We have kids that, have sensory challenges.
Yes.
Like we have so many different things that we need to take into consideration. And that's why I love your approach, and I love how you continue to evolve your approach.
Yeah. And you are constantly exploring also other things that can help with that. When we're doing expansion, it is affecting the whole nervous system, the whole body. And so you've created this oral recovery kit, which is homeopathic medicine.
Yeah.
And so explain to us like how this came about.
Yeah.
And there's several components to it.
Yeah.
And kind of how you use it, who can use it, and things like that. It's really exciting.
So personally, I lean on some holistic approaches when I can. I love Western medicine for sure when we need it. But my oldest, Ben, he, particularly has a more sensitive system.
Yes.
And so I've just, as a mom, tried to learn more about what's out there, and try to make like a longer story short. Actually, one of my patients that I work with, the mom is a functional medicine practitioner.
Amazing.
And she and I have just become kind of fast friends, honestly, and because I was working with her daughters.
Okay.
And she and I were chatting one day, and I was asking her, because we were going into expansion with Ben, how can I support him? And her daughter was approaching tongue-tie release.
Okay.
They live in Tennessee.
Okay.
And we were talking about those. And we both had like this light bulb moment on the phone, like, this needs to exist.
I love that.
Like, we're putting together protocols. This just needs to exist for these families. And so really what is in here, there's 3 homeopathic remedies. And these are full-size vials. If you're not familiar with homeopathy, like these guys will last you a very long time. And yes, this is geared towards oral procedures, but really, this is my kit. Like we use this all of the time, right? The arnica is great for any type of pain, discomfort, inflammation.
Yeah.
I have 2 boys, so let's be honest. They're, constantly. And so this is really built for like the emotional and physical support, nerve pain, tissue regeneration, but also just like the nerves, and not just for the kid, for the parents too.
Yeah.
So we've got the Calm Drops, which is an herbal glycerite blend. It's so delicious. You can use this for 6 months and up. Everything else in the kit can be used for all ages, so newborn and up, which is amazing because I think that's sometimes hard, especially if you have a little one.
Yeah.
It's really limited of what you can use over the counter.
So if a kiddo, let's say they were going through expansion or going to start, how would you instruct, or what would be your recommendations to use these things?
Yeah, so this is just like simple. You could use this going in before, right? Because it's like nerves, if they're nervous, things like that. And then there's which is cool. We've tried to really make it very user friendly.
Sure.
So in the kit, I actually don't have it with me, but there's a card. It has a QR code. And it will take you right to instructions. So for expansion, use this. And it walks you through it. But essentially, you're alternating. This is an oral recovery blend and the arnica. So you alternate these after it's placed for a pain. And then this is great, like to add in. This is the tension and tissue. This is great for tongue-tie releases, things like that. So and wound healing.
Cool.
So it's all built in there to make it super user-friendly. And then this is actually, my jar is empty because we use this so much.
Okay.
This is a topical salve.
Okay.
And it's one of my favorite things in the kit. But you can use it extra-orally and intra-orally.
Oh, interesting. Mm-hmm. Okay.
So not fresh on the wound. We start like around day 5, 4 or 5. But you don't even have to go on the wound. You can go around, and it's absorbed into the tissue.
And what's in that?
It is an organic infusion of jojoba oil. Colleen made this, my co-creator, and it's a beautiful blend. I've seen awesome things with this as far as like tissue healing. So and it doesn't really have a taste. So it's not like kids are going to be like,
Can you use that on an infant?
Okay. Absolutely. Interesting. And so you could go sublingual under the
Yes.
floor, and even two, because it absorbs into
Okay.
the tissue.
Very cool. Yeah, and you can find the information for all of this stuff on our show notes. But we are also looking into carrying this in the office for our patients. So look out for that. And if you could share kind of, we were the parents that were kind of lost on our journey. And luckily we are in the dental field, so had access to finding our way, although it took us years to get there and then apply it to our own children. What if someone is looking for a myofunctional therapist, where would they go if they're not local to Houston? What is like a go-to resource? And what should they be looking for in a myofunctional therapist if they find one? Because, the myofunctional therapy training is not uniform. And we know that. We know there's some misconception about it's just a set of exercises that you can do. And we know that it needs to be individualized care. So what would be a good, if you will, vetting process for someone to find someone like yourself?
Yeah. So, so for one thing, as a sidebar, with this kit, I did put together 3 different digital guides.
Okay.
That support you through expansion. It's like just an extra little arm. It's not meant to replace your working one-on-one with your functional therapist, but in one of those digital guides, I actually have a wealth of information to kind of bring together exactly what you're just asking.
Okay. Oh,
how
very
to find
cool.
the right provider.
Okay.
Because
awesome.
a lot of times people find stuff like this online and they haven't found their team yet. And so I really wanted that to be in there. And so that is a resource, and I do have those guides separately. But there are some amazing organizations that we're a part of that have great directories. Airway Circle is one, the Breathe Institute. IAOM is one of the orofacial myology organizations that I'm a part of. Those are all solid resources, and they all have a directory page that you can go to. And providers that have trained with those organizations, are usually pretty top notch, right?
Yes.
But I think honestly, the hard part about being a parent trying to find the right myofunctional therapist can actually be kind of challenging.
Yeah.
And because if it's dependent on age, if we have more needs outside of just traditional myofunctional therapy, do we have feeding therapy needs? Do we have speech therapy needs? So there can be a little bit complex. And so my suggestion is you can go to those organizations, find some people in your area, call them.
Start there.
That's one thing. I will point people. I will say, I'm not the right person for you, but my colleague is over here. Or even better is go to someone like Dr. Gandhi, like you, because you're going to, all the people, right? You do, you're so well networked, and usually dentists in this space have built their collaborative teams. And
that's a good point that you say, like, you said now the word team a couple of times. And, we do want to focus on the fact that this type of treatment takes a team. It's not just me. It's not just you. It's not just a chiropractor or a, speech language pathologist. It's all of us working together.
Absolutely.
And building a team can take a little while. But the importance of having a well-rounded team is how you get all the results that we're looking for. Because everything is a step in that direction for proper breathing, sleep, and health.
And it can feel a little bit overwhelming for families, because it's like all of a sudden
if they keep hitting walls,
them, So I really try to meet the family where they're at and try to, alongside with you or the doctor that we're working with, is how do we prioritize the needs so that we're not trying to just do
overwhelm.
Absolutely. So if we need to do expansion first, go do that. Get space first.
And then
come back to see me,
Yeah, no, I think that's good. And I think realizing that, and the reason we realize that is because we are both parents and know what it's like to juggle. We're not just juggling our airway health team, but we're juggling all the sports and the school and
Yeah.
all the things. So yeah, making it realistic and user friendly is the way we achieve these goals.
Yeah.
And honestly, for every family that looks different, you know, so it depends on their capacity and their need.
Absolutely. Yeah.
Well, any final words that you want to share?
I mean, I think I feel really blessed to be in this, in this field. And I think, I would love to encourage anyone that's in dentistry, dentist, hygienist, even if you don't want to do this type of work in your own practice, I think it's so important that we pursue education and to better understand, because I think while we've made huge strides in dentistry, I think there's so much more to go. There's the average dental office is still not having these conversations. I think these types of referrals should be made just like if a patient needs a root canal, you send them to an endodontist, right? We should be sending for airway evaluations. And unfortunately, there's so many adults that are walking around that have no idea that there's treatment, there's options out there.
The goal is not survival, it's thriving. Yeah.
And, if you're a parent in this journey, just know that the people that are in this field, I think we're all so passionate about it. We have such a personal connection, like we truly, really want to help. And there is a light at the end of the tunnel.
Yes. Don't stop looking. Yes. You will find your team.
Yeah.
Well, thank you so much
absolutely.
for, pushing this field forward, making these amazing products to educate and help our patients through the airway treatment. I love working with you, and I'm grateful to have you in our circle.
Yeah.
And thank you so much for being here with us today.
Thank you for having me. It was really fun.